insurance option. So I thought in terms of getting people access, it did a pretty good job. In terms of actually slowing that cost growth, I didn't think the House bill did anywhere near enough. I didn't think it did a great job. So did a lot of stuff that I think people wanted and I support and still support and want to see us do. But I think the critical issue that we missed in the House bill was how do we and can we slow down that cost growth? Because that's what I heard consistently. Liberals, conservatives, Republicans, Democrats, it didn't matter. Everybody is worried about how fast that insurance premium is going up every year and wants to see anything we can do that's going to help take efficiency, make efficiency in the system, take waste and abuse and inefficiency out of the system so that we don't have those costs going up so fast. And I didn't think we did a very good job on that in the House bill. I think, you know, there are people that disagree and say we did a better job, but mostly people that think they should have voted for it say, hey, but it did all this great stuff that I agree to. And a lot of people say, well, we'll get to the cost stuff later. I just don't think we can say that. I don't think we'll get to the hard cost stuff if we don't do it now when we've got everybody at the table. The pharmaceutical companies, the insurance companies, the doctors, the hospitals, everybody are at the table. This is the time to do it. And I didn't think we did it. I'm hopeful that the Senate is going to do a better job and send us back a bill that does more of this cost control. They're doing a number of things on the Senate side that we didn't do on the House side that I think most of the economists think are going to actually help on that front. And so my statement on where I am, people say, well, where are you? You're going to vote for the next bill. Will you vote for health care reform? You said you were for health care reform, but you voted against it. I'm for health care reform. I'll repeat that. And if we get a bill that does all the things that we're trying to do, I'll vote for it. So I'm definitely open to voting for a Senate bill, but I won't vote for it if I don't think it's going to make the system better overall and actually solve the problems we're trying to solve. But this is our big opportunity to do it. So that's my thoughts about health care. They're longer than people wanted to hear probably, and maybe they're even understandable, or maybe I just confused the heck out of everybody, but I'm trying. So.
Well, the one question I had on the health bill, wasn't it, I think it's your words that I've heard, that basically with their cost, it did not come into play inflation and interest involved in their price tag.
Involved in the price tag, like in terms of what it would cost the government?
Yes.
No, that wasn't so much. I don't think, if I said that, I don't remember saying it, but it doesn't mean I didn't. I talk a lot, but no, it's not so much that they didn't calculate.
I hope I can use that line sometime.
Yeah, it's not so much that they didn't calculate interest right or something, but it is this inflation of the cost of premiums. It's how fast premiums are going up is really the thing that I think we've got to change. And so, how do you do that? Well, one of the things I think we should do is incent people to take care of themselves, to take good care of their own health. I hear this from doctors and hospitals all the time. One of the big issues is that there are a lot of patients that come in that aren't taking care of themselves. How would I do that? It's not a penalty, but here's your premium. You get a discount if you keep your weight off, if you exercise, you keep your blood pressure under control, you keep your cholesterol down, you don't smoke. All the things that we know will help our health. We can do it ourselves. Government's not forcing you to do it. Nobody's forcing you, but just let's set the right incentives, because people respond to incentives. If I can save 30 or 50 bucks a month on my insurance, maybe I'll do it. Maybe I won't. That's okay. It's my choice. That's the American way, but at least let's build the right incentives, because right now we don't have those incentives in our system, and we didn't do that in the House bill. We didn't do enough to change the fee-for-service model in our insurance system. Right now, doctors become doctors. I got a bunch of doctors in my family. A lot of you probably know my family is doctors. Dr. Hogan in Hudson Falls was my father-in-law, was a town doctor there. They didn't become doctors to see how many transactions they could have, how fast could they see people. They became doctors to get people well. But our system says we'll give you $40 for every time you see a person, every 5-minute visit. And so we've set up a system that encourages you to have more visits, more transactions, because that's how you pay the bills. That's not the right way to do it, and that encourages overutilization. And for doctors who maybe did become doctors somewhat to make money, which it happens in some parts of the country, then they just see more patients, they just order more tests, and they make more money. That's not right. You shouldn't do that. It should be for getting people healthy, and it should be oriented towards quality, which is why most people became doctors, and that's what we want out of the system. We don't want a lot of transactions. We want healthy people. Those reforms can be done. We can make progress on this. The Senate's doing a better job, and I'm hopeful that we'll get something back that actually will do that. And then what you'll see is not only will government's costs for health care be less, but so will every private company and every individual and every farmer. Their costs will be less because the overall system will cost less, and I think we can have healthier outcomes, which is that's the holy grail, healthier outcomes and less cost.
The Senate bill is, I think it's $870 billion, they're talking about.
848, yep.
848?
That's the number I read.
Okay, fine. I hear the pundits talking, even if it's 848, it's smoke. I mean, it's gonna cost much more than that. This is an unrealistic, approach, even though they've come into a dollar figure. What are your thoughts on it? Is this a real thing that could happen if it gets through and it'll stay at that price, or is it gonna be a lot more?
I spent a lot, because I'm a numbers guy. I come
Yeah.
from being a business person, and my part of the business was always kind of the finance side, the number side, so I love numbers. I've spent a lot of time looking at the numbers. I don't think that the numbers are crazy. I don't think that they're way off. Could they be off one way or the other? Yes. But I would disagree with somebody who says they think that those numbers are not close. That's not my biggest concern with it. I think that they're reasonably best guesses. They could be wrong, but they're guesses for 10 years out. But I don't think that they're just lost. And that's. But the key issue to me is, are we changing some of these incentives that impact the cost everywhere? Because everybody's talking about the cost to government. That's the number we quote. But the cost about health care is not just the government, it's every entity, right? Every business. And if we can slow that down, government will be better off, but so will everybody else. And that's the part that's not even in those numbers, is how much do we save, Finch Prine in terms of what their insurance is going to go up, or town government in terms of what their insurance is going to go up. And that's why that cost curve is such the focus, such a big focus to me. Covering everybody, I think, is great. We need to do that. But if we can do it with the cost at the same time, then we've got a really good reform bill. Or that's my take.
Well, the more you talk, the more questions I get. But
well, that's the nature of this project.
The federal government, I'm not picking on you personally, but just the Fed, our intent on decreasing the cost of health insurance, or the profit that the private insurance companies make. How can you even, why don't you consider tort reform? Nobody's talking about it.
Some
And
of us
that's
are.
major, I would
Some
think.
of us are talking about it.
Well,
You see in
it's
my
not
editorial.
coming out in the
Yeah,
newspaper.
well, you'll see in my editorial that I wrote about my vote that I thought we needed to do more on tort reform. There is a little bit of tort reform in the House bill, allows the states to do a couple things that they may not have been able to do before. My
I can
best,
see where we can't think the federal government is serious when they don't address that.
yes, I think that we need to. Yes, you're right. It's a couple. I'll give you some of the facts around it that are important. I think there's two things in there that a tort reform gets to. One, medical malpractice insurance. The insurance liability is about 1.5%, 1.5% of total healthcare costs. So cutting it can help. It's a big number. It's not going to take more. If you got rid of liability insurance altogether, it would only save 1%. So it's meaningful, but it's not by any means the biggest thing that we could work on. Defensive medicine, which nobody knows what defensive medicine exactly is, but the idea that doctors order tests to protect themselves from getting sued, that's a bigger category. And that's the one that I think we need to be doing even more work on. And that's what we're trying to. And it goes together. Well, tort reform is part of it, but what we see in the data is 47 states, have done some kind of tort reform, but most of the overutilization or defensive medicine tests haven't really dropped. They'll see their liability insurance drop, but the doctors are still ordering a lot of the tests. And part of that is, just think of the dynamic. You're in a room with a doctor, you've got insurance, so you're not paying the bill, it's going to go to your insurer. And the doctor, maybe not your doctor, but a lot of doctors in America get more money if they order more tests, because they have a fee for that test that they make. So there's really, that's the broken incentive in the system. Nobody's in the room thinking, how do we save money here, or is this worth it? And the doctor says, well, maybe I get a little information, and hey, it costs $2,000 for this test, but I'm going to get $100 out of it. So the incentives are wrong, and I'm not saying doctors are doing this evilly. It's just the incentives are what they are, and incentives matter in systems. And so that's what we've got to work on.
That's a test that wouldn't hurt, and you got insurance, let's do it.
98% chance I know you got an infection. I could give you a $20 antibiotic and you'll be better. But there's a 2% chance you might have some strange thing I don't know. But I could send you over to Glens Falls Hospital and run an MRI. It costs $1,000.
How are they going to fix that?
Well, partially it's having people have some skin in the game, so they're thinking about it. And partially it's having it towards outcomes. And so